witnesses have 6 minutes left.
Okay, hi everyone. My name is Melissa Floyd. I'm a data analyst and educator for the last 15 years, specializing in mathematics. I quickly need to say that opposition to this bill is not an opposition to vaccination. No one here is suggesting that we stop the vaccination program, and that's important. We've heard that AB 2109 is working. We know that vaccine rates are up and personal belief exemptions are down. In fact, in 1 year, they've decreased 19%. Now, 277 aims to completely eliminate that narrowly used exemption, which encompasses 2.5% of children in California, most of whom are partially vaccinated. They are misclassified as unvaccinated. In fact, less than 1% of children in California are completely unvaccinated. That is just not enough to affect the community immunity levels of our state. The bill authors have continued to perpetuate the idea that California schools are not safe and that PBEs are the reason, but I'm here to provide the facts that will state otherwise. Number one, the authors have said that over 100,000 people die of measles every year. But what they're not telling you is those are global numbers. The CDC says not one person has died in California or in our entire country in 12 years. The United States has a population of 330 million people, and there has not been one death in over a decade. Also, measles contagion ratio is 12 to 1. What that means is our first 100 cases should have been 1,200 cases and then would have been 14,000 cases and grown exponentially. But it didn't. And why didn't it? Because our vaccination rates and our community immunity is high. And we have these excellent quarantine measures in place. The outbreak was contained in a number of weeks. There was no public health crisis and certainly no epidemic. You've heard Dr. Gordon testify about pertussis or whooping cough, and only 10% of the kids last year in California were unvaccinated. The reason this is so important to understand is because these outbreaks cannot be blamed on the unvaccinated children, and eliminating that PBE is not going to eliminate the pertussis problem. Let's address this pockets of low vaccination we keep hearing about. The idea of pockets does not take into account the size of schools, districts, or counties. In other words, PBE percentages are all relative. One single unvaccinated child carries different weight depending on the class size. So one student in a class of 100 has a 1% PBE rate, and that's not a cause for alarm according to the authors. One child in a class of 10 has a 10% PBE rate, and that's considered a significant risk. But we're still talking about the same one child. Also, the distortion of data takes these small sample sizes, and what it does is it represents them as data for larger populations and as a whole, which is inaccurate. Important to note, there is no correlation between the PBE percentage rate and the incidence of disease. LA County has a PBE rate of 1.62%. That's very low. And they had almost 30 cases of measles. Marin County, on the other hand, has over 6.5% PBE, and they had 2 cases. The same can be said about pertussis last year. 3 of the 7 counties that had the most cases were over 95% vaccination coverage. So there is no connection here between PBE percents and incidence of disease. Rather, it is random and geographical. I ask you to look at the facts because the facts are clear. There is no public health crisis. Please oppose this bill.